in the frame of the European Hematology Association working group on MPNs, we could collect a large cohort of young patients with MPNs, meaning patients who have an MPN that were diagnosed before 25 years of age. And among 14 countries, we could collect a cohort of 444 such patients diagnosed very young in their life and see if their characteristics were different from those of elderly patients or older patients. And in fact, we found first that such patients are not so rare. If you look for them, you will find them in each different centers. They are mostly represented by essential thrombocythemia, and there's a female predominance in this young population. However, the molecular landscape, for example, is not different from that of elderly patients. And in addition, we found that they were indeed, although young, exposed to high rates of complications. For example, the cumulative incidence of thromboembolic events in this population was evaluated at around 10% after 10 years of follow-up. That is quite high for such a young population that doesn't have usually any cardiovascular risk factors, contrary to patients diagnosed elderly. Second, the cumulative incidence of hematological transformation from PV to myelofibrosis, for example, or from myelofibrosis to acute leukemia, was also quite high, evaluated at around 10% at 20 years of follow-up. That seems long, but when you're diagnosed at the age of 20, for example, it means that the median age of transformation risk is around 40 years. In addition, for patients with polycythemia vera, we found a median overall survival of 35 years. That again seems long, but please consider that these patients are diagnosed before 25 years of age. So I think we may underestimate the risk of complications and transformation in this younger population, and probably we have to revise our management of these young populations of patients with MPNs.